Risk Identification Sensor Technology. Meet our team, Karishini, Silvia, Noella, and Robyn. Deep vein thrombosis, or DVT, is a condition affecting 45,000 patients in Canada annually. DVT is characterized by the formation of a blood clot in a deep vein in the body such that it diminishes blood flow. There are several reasons why you might develop DVT, including pregnancy, knee arthroplasty. However, the largest predisposing factor is immobilization of patients over the age of 70 who have just had a knee replacement. Meet Sally. She's 75 years old and has just undergone a knee arthroplasty. Sally learns that immobility results in the highest incidence of post-operative DVT, with 41 to 85% of patients experiencing this complication. She realizes that this is why her physiotherapist Sam recommends that she performs exercises while also attending her regular physiotherapy appointments. Unfortunately, Sally doesn't listen to Sam and doesn't exercise as regularly as she should because she thinks her prescribed blood thinners will prevent her from DVT. Little did she know she still has a 2 to 5% chance of developing DVT. Because there is currently no technology to identify the risk for DVT, over time she unknowingly develops a blood clot in her calf and is rushed to hospital. At the hospital, her surgeon uses a Doppler ultrasound to diagnose that she has developed a DVT. Her surgeon asks if she has done any physiotherapy exercises. Sally says no, but shows the surgeon her Fitbit, suggesting that she has taken many steps. Her surgeon tells her that while walking is beneficial, her Fitbit does not ensure that her movements are improving venous blood flow to her calf. Sally wishes someone had told her about this earlier because she is now at risk for life-threatening conditions including pulmonary embolisms or post-thrombotic syndrome. Let's take back time now to show you how this could have been differently if Sally had been known of our new technology, wrist. Now, if the doctor had given Sally our FBG grading technology called wrist, her physiotherapist Sam could have identified that she was at high risk for developing DVT, and then her next appointment was tomorrow. FBGs are the most widely employed sensors built directly into the optical fiber. Each FBG is made by inscribing a permanent refractive index change in the core of the optical fiber. When an incident's broad spectrum of UV light passes through the grating, a specific wavelength called the Bragg wavelength is reflected back, and the rest of the spectrum is transmitted through unaffected. When an external strain is applied, the FBG reacts to create a proportional shift in the relative wavelength. With wrist technology, Sally's physiotherapy team is able to ensure her movements are significant enough to protect her from DVT. Therefore, now when Sally doesn't perform her exercises, Sam gets a notification on her dashboard. Based on the notification, Sam calls Sally to make sure she comes in for her appointment tomorrow so that she can assist her in changing her behaviors. After speaking on the phone, Sally agrees to meet Sam at the hospital the next day. Sam explains to Sally the research behind the application of FBGs. When compared to the Doppler ultrasound that assesses blood velocity, FBG microstrains measures corresponds closely. Performing ankle plantar flexion exercises, the Doppler ultrasound shows blood velocity to be 128 centimeters per second, which corresponds to 500 microstrain. This is why I knew you weren't doing your recommended exercises, Sam says. Because you weren't moving, the FBG on your calf did not experience any strain, and there wasn't any shift in your Bragg wavelength. This tells me you were immobile. Sally is impressed with the technology but has many questions. She understands that she can't take a shower for a few days after her surgery, but wants to know if the device is something that she can take off while she sleeps. Sam reassures her that this won't be a problem because the FBGs are attached to a Velcro strap that goes around her calf and can be removed at night if she wants to. Sally worries about whether wrist will protect her privacy because it's constantly monitoring her movements. At the physiotherapy clinic, wrist will be connected to the hospital's secure wireless network to protect personal data. Doctors will log in with their username and password, which will have to be changed every 3 months. Patient data will be encrypted, requiring asymmetric public key infrastructure to decrypt. Sally just has to make sure that the tablet of the hospital she is using is protected through a wireless network. Sally questions whether this will cost her money. Sam assures her that this is now covered by OHIP and that it even saves the Canadian healthcare system money. Canada conducts approximately 123,000 knee and hip arthroplasties every year. A primary DVT diagnosis costs an average of $4,000 per admission, and considering that 2 to 5% of knee and hip replacement patients develop DVT, this translates to $9 to $23 million spent on DVT care every year. Isn't this a lot of trouble for you, Sally asks? Sam tells her no. She loves using wrist because the developers placed a large emphasis on usability and included her in the entire process. In fact, the developers used 14 heuristics to improve usability. These include consistency, visibility, match, minimalism, memory, feedback, flexibility, message, error, closure, undo, language, control, and document. Sally has one last concern. Will this even work? How do you know the application on your iPad will help me with my immobilization? Sam explains to Sally the premise of mobile health and how it is commonly defined as wireless devices that are intended to be regularly worn by patients with the goal of monitoring or improving health statuses and outcomes. Sam explains the various benefits associated with mobile applications. This includes the potential to decrease healthcare costs, support disease self-management, provide personalized intervention, allow for continuous monitoring, and prevent or reduce the risk of developing chronic or acute illnesses. Research has also demonstrated positive results when using mobile health applications. Participants have shown decreases in depression, distress, anxiety, and stress after using mobile mental health apps. Self-efficacy scores have also increased for individuals with type 2 diabetes who regularly receive text messages with diabetic management reminders. Participants were also able to better manage their caloric intake when using mobile applications. Sam explains that all these factors together is what makes a mobile application wonderful to remind Sally to do her exercises. Sally is definitely surprised with how far mobile applications have come, and Sam continues to explain that the healthcare gap that RIST is addressing. Although there are inpatient measures such as blood thinners to prevent the development of DVT after surgery, immobilization is still a huge risk factor. Before RIST, there was no way to identify at-risk patients once they leave and potentially prevent a DVT. RIST helps us with this problem and allows us to potentially detect a DVT before it's too late. RIST also provides different avenues to pursue in the future, explains Sam. For example, the FPG sensor technology can be further explained to include additional features for the patient to encourage mobilization and exercise adherence at home. A patient user interface can be developed to send reminders to encourage the patient to move and complete their daily exercises. In addition, the application RIST can be extended to be used when a patient is immobilized due to hip arthroplasties or heart failure. Sally is so impressed with this innovative technology that she wants to provide her feedback. Sam explains that the developers at RIST are dedicated to gaining patient and physiotherapist feedback through satisfaction surveys. We can fill out these surveys and then send them to the RIST developers in order to provide our feedback. However, before actually developing RIST, technical, organizational, and economical feasibility factors have to be considered. Clinical trials must be conducted in order to gain a greater understanding of the efficacy of FPGs in terms of identifying at-risk patients for DVT and validating them as a reliable measurement tool. Future research must also focus on developing a baseline microstream level to identify a specific level at which patients are at risk for DVT. Organizational feasibility will consist of how to help patients and physiotherapists successfully integrate and adopt the FPG sensors into their practice. Factors to consider include returning the FPGs to the hospital after use, having a wireless network connection in the physiotherapist's offices and patients' homes, developing protocols to educate stakeholders, and creating a comprehensive change management plan to allow for successful adoption. A positive aspect of FPG sensors is that physiotherapist and patient burden will not increase. Since Canadian hospitals may be spending as much as $24 million annually from just knee and hip surgeries, finding a mitigation method for preventing and identifying DVT is essential to assist with healthcare costs and improving patient care. In conclusion, RIST technology is a promising tool to identify at-risk patients for developing DVT. By having physiotherapists monitor patients' mobilization through their personalized dashboard, as well as keep patients updated regarding their DVT status, RIST technology can improve surgery rehabilitation and prevent the development of DVT.